Well, good afternoon, everyone. Welcome to today's webinar focused on SNAP myths, otherwise known as obstacles that individuals often find that prevent them from even applying to SNAP to see whether or not they're eligible to receive certain benefits that could assist them for food security. AARP Virginia welcomes you. I want to say hello personally. My name is Brian Jacks. I am a Associate State Director for AARP Virginia and work out of my teleworking office at home in Bedford County. Uh, I am glad to see such a good turnout today. We had more than 140 individuals registered to participate with us today. We're glad you're here, and I would like to draw your attention right away to the chat function. Let's make sure that everyone has that pulled up on whatever device you're using so that you can see some of the web links and questions perhaps or answers that are laid into that chat box. I want to let you know that individuals are going to be able to chat with everyone. Let's keep our discussion civil and focused on encouraging one another. We also want to make sure that you see the Q&A box, question and answer box, which is located at the bottom of your screen. That's where we're going to give you the opportunity to post questions throughout the presentation. This is a webinar, so you'll not be able to raise your hand and speak as part of the event, but we do want to make sure we're attempting to address any and all questions that come as part of the material that is going to be presented. I'm so thankful that you're here, and I want to make sure as we begin this that there's an understanding that AARP does care about senior hunger and food insecurity. I'm looking at one of our more recent data uh, stories on the internet. AARP writes, most adults 50 plus believe senior hunger is problematic. And the view that senior hunger is a big problem has risen recently. AARP's advocacy work on senior hunger is seen as important by majorities of men and women, irrespective of age, with income being a key driver of views towards AARP's advocacy on this issue. When asked how increasing grocery prices have affected how they shop for food, about half of adults 50 plus report spending more money and buying cheaper brands. And when trade offs are needed to pay for food, transportation expenses are the ones most commonly reduced by midlife and older adults, followed closely by utilities. Rising food prices are now affecting one half of adults 50 plus, at least several shopping days, with the percentage saying prices have never affected their ability to access food dropping notably. Rising prices of food are the top factor affecting midlife and older adults' ability to access food. Obviously, SNAP benefits have a direct impact on the amount of resources individuals age 50 and over have to accessing food. Nutrition and quality is going to be something that we talk about today. So I'd like to welcome you and ask if you would to just begin the chat box with some activity by posting the location where you're zooming in from. I'd like to see where folks who are participating happen to hail from, and we may reference that a little bit further in the presentation. I'd also like to introduce you to Anna Jo Paroli, one of our newest AARP volunteer community ambassadors. She happens to be a university student and has an interest in social work and helping others. You'll note that AARP's work around hunger is not solely contained to advocacy, but instead involves community outreach. AARP Virginia has been involved in hunger efforts, food drives, and the like for more than a decade. And Anna Jo is going to be helping us out in different ways over the course of this year. I also am pleased to introduce you to our main presenter today. Monica Kelly is an outreach specialist working with the Blue Ridge Area Food Bank, and she has presented this presentation before for us in 2024. It was well received. We got a lot of great questions, and Monica is one who has answers for most and all of them. She's worked in the area of hunger for many years, and we're just delighted to have her with us again today. For those of you that have just joined in, I'll again make the request that if you have questions specific to SNAP or other hunger outreach or food insecurity questions, you may post those in the question and answer segment of Zoom. We'll answer them towards the end of the program, and I hope everyone can see the Q&A button at the bottom of your screen to put those questions in for us. If you drop them into chat, we'll also attempt to add them to the list and make sure that we cover those towards the end. But the Q&A box is the best method for ensuring that your question is addressed. I'll quickly mention that we have folks tuning in from all across the United States, California, Illinois, Florida, Colorado Springs, Colorado, Pennsylvania, Arizona, South Carolina, New York, Alabama, Wisconsin, Georgia, Texas, Minnesota, West Virginia. Let me say that, Monica, you may have your work cut out for you. I know that SNAP is a federal program. You may mention some things that we're doing here specifically in Virginia, but I just want you to realize that we have a number of guests from all across the United States, and that's a good thing. With that, I'm turning it over to you, Monica, and thanking you for being with us today.
Thank you, Brian. And I did see that we did have a lot of different attendees from all over the country. So I will be sure to just be mindful of that, because as we know, SNAP is a federal program, but states can opt into certain options in which they want to administer the program. So that means eligibility requirements may differ from state to state. But if you have any questions, feel free to put in the chat, and I will just be sure to keep it very general today. So I'm going to go ahead and share my screen. All right. So today we're going to be talking about SNAP. So let's go to the next screen. A part of our agenda today is that we're going to talk about the food bank. So I work at the Blue Ridge Area Food Bank. I'm located at our branch in Charlottesville, Virginia, but we cover over 25 counties and 8 cities. We'll talk about what SNAP is. We'll review any myths and misconceptions. We'll discuss some eligibility factors. We'll talk about how to best maximize benefits, how to apply, and then any necessary next steps. All right, so to begin, let's talk about what a food bank is. So the Blue Ridge Area Food Bank, we are a food bank that serves from Lynchburg to Charlottesville to Stanton to Winchester. We secure donations and we purchase food. We move that food, we prep it, we store it, and then we distribute that food to local food pantries that then distribute that food to their local communities. So all of these things equals nourishing food for everyone. So when you think about a food pantry and a food bank, remember the food bank, we're the warehouse, we're the distribution center. The food pantry is where people can go for all sorts of different food. So as a food bank, you may know that we are in the world of moving food. That's our goal. Our goal is to move food, make sure people have meals and food to make meals. Well, that's the traditional idea of a food bank. The more modern idea of a food bank is that we're supporting individuals with all the necessary resources needed to have all the Ridge Area Food Bank, we prioritize three things when ensuring that we're providing our neighbors with all the nutrition they need. We prioritize eliminating disparities in access to nutritious food. We prioritize improving the health of our guests, and we prioritize supporting household financial stability. And so, as a food bank, we can connect our neighbors with other resources that support food security and health to make more lasting change for our neighbors. Because fewer than one third of guests currently use household, uh, one third of our households currently use SNAP, right? And that's only one third of everyone that's eligible. So we are in the process of improving our ability to help people apply for SNAP benefits. So in order to ensure that there's equitable access to SNAP benefits, there's several things that need to happen, right? We need people advocating at the policy level, advocating to strengthen or raise those minimum SNAP benefits. Because currently, the federal minimum benefit for seniors is $23. $23. So we need people advocating to their legislators, to their government, to raise that minimum SNAP benefit for our seniors because we all need more than $23 a month to buy groceries. We also need to provide enrollment support. So if you've ever seen a SNAP application or if you ever applied for any government benefit, you know that it's not easy. That application is over 15 pages long. And if you're applying over the phone, it's going to be about 30 to 45 minutes. So having people who are trained and dedicated to supporting individuals applying for SNAP, that can make the process so much easier. I remember when I first joined the food bank, I was supporting this woman who was in housing. Her rent was about $500 a month. Her income was $600 a month, right? She was over 70. When I showed her that SNAP application, which was over 15 pages long, she was immediately overwhelmed. She said, Miss Monica, you're going to be doing the reading and writing. I'm just talking, right? I said, yes, don't worry. You're just talking. I'll write down your answers. So having dedicated and trained support can really mean the difference between someone actually taking the time to apply or just trying to figure out a different way to get themselves some support. Perceptions. So this is why we're here today. We're here today to learn how to improve SNAP perceptions and reduce stigma by growing allies and champions for SNAP. So basically, that means we're here to learn how to dispel those myths and misconceptions. When we talk about SNAP, we want to lead with facts. So let's start. What is SNAP? SNAP is known as the Supplemental Nutrition Assistance Program, but it's more widely recognized as food stamps or EBT because that's how people know it. SNAP offers nutrition assistance to eligible low or no income individuals and families. Remember, it's a federal program that's administered by the United States Department of Agriculture, but distribution of benefits is determined at the state level. This gray card that you see on the screen, this is how SNAP recipients utilize their. They have this card. It's called an EBT card, meaning electronic benefit. Oh, sorry, my slide went forward. Let's go back. Some internet difficulties here. I can everybody see my slide that says what is me?
So, Monica, I'm hearing a little bit of a kind of like breakup in your sound as well, and I'm not sure if if you've got your laptop plugged in now, it's all the low battery pop up. Can you hear me clearly? And I just want to make sure that everyone else is hearing you okay. Okay, everyone. I am seeing that Monica's computer has in some way blipped out. And I see in chat that one of Monica's coworkers is saying her computer has frozen, but she is working on getting back in. And sorry for the delay. So let's spend a few minutes here to look at what some questions that have already popped in, just to make sure that we're on the same uh, page. Number one, are all SNAP benefits the same for each state and by county in each state? That's a great question. Um, Looking at, will the replay be available? We do intend, this meeting is being recorded, so we do plan to send out a recording. A question about insurance in relation to SNAP. I'm not sure how that, you know, perhaps affects one's eligibility, but I think it's primarily based on the amount of income coming in, income and possibly assets. Um, and then there was a question of BBCE. I'm not sure if that was one of the acronyms that Monica had mentioned. I will say, let me personally answer one of these questions in reference to I had trouble attaching my necessary documents for qualifications. This pertains to the idea of how to enroll. And as Monica was mentioning, oftentimes the process for checking eligibility, actually applying for SNAP benefits, does involve a bit of paperwork, and it is a process. Things have to be currently signed by hand and sent in. One of the things that I'm thankful for the understanding is that most of the food banks, those are, again, true food banks, not necessarily pantries in the basement of the church or a pantry that's operated by a nonprofit, but food banks throughout Virginia, and I believe in other states across the United States, have trained individuals like Monica who are dedicated to outreach and dedicated to helping people who are eligible or who are wanting to check their eligibility walk through that process. So one of the things that I would encourage here in Virginia is for residents to reach out to the Federation of Virginia Food Banks. I'll put that web address in the chat, or maybe I'll ask Anna Joe to do that. The Federation of Virginia Food Banks has a listing of the entire state with a map showcasing which of the actual appointed legal food banks cover those different regions of Virginia. If you reach out to one of the food banks directly, they can connect you with the outreach person who will help you walk through that process. Secondly, I'll say that Virginia has a telephone resource, which is 211. All right, it's not 911, the emergency services, or 811, the number that you would call before digging to make sure your underground lines are marked properly. But 211 is a help resource in Virginia, and the operators there can tell you which of the food banks covers the area in which you live and can direct you to the right person to begin that process of applying. Um, and again, I know that oftentimes gathering the right documents and then, as was mentioned here in the chat, uploading those documents so that your application is thorough, complete, covers all the information that you need. Um, I just want to say that I'm thankful that in Virginia, our food banks are committed to helping walk people through that process. And Monica is the type of outreach specialist who, in the Charlottesville area, even dropping down into Lynchburg, Amherst County, I believe, um, can assist with that type of application. Monica, we can see you now. You let us know if you're getting everything fired back up or if
Oh,
there's
I'm ready. I'm
any.
ready, Brian.
All right, then I'll keep quiet and appreciate you, figuring out a way to get back up and rolling.
Yes, I always say about myself, if I'm not something, it's resourceful and it's adaptable. Okay. Because I don't know why these technical issues wanted to bring us down today, y'all, but we are going to prevail and we're gonna start again. I think everybody should be awake now. So let's go ahead and start.
Great. And I want to thank Anna Joe for putting the correct link in for the Federation of Virginia Food Banks locator. All right, continue, Monica, and thank you.
All right, y'all, take two. So I believe, if I remember correctly, we left off talking about the Virginia EBT card, right? We know that SNAP is called SNAP, but the community doesn't know it by SNAP. It knows it by food stamps or EBT. And the reason people know it is EBT is because SNAP recipients see the Virginia EBT card. That's how they utilize benefits. You might have heard of recently a lot of SNAP recipients getting their benefits stolen, right? And it's because if you notice, when you look at this EBT card, there's no chip on it. There's no chip. So these EBT cards does not have that extra layer of security that normal debit cards would have. So that means SNAP recipients are more susceptible to fraud, meaning one day they will get their benefits, and on that same day, they'll go to the grocery store, swipe that card, and their benefits will be gone, stolen. And currently, those benefits are not being reimbursed to those who had them stolen. All right. So, with SNAP benefits, you can buy food, but only food that is not hot at the point of sale, right? So, when you go to the grocery store, whether it's Wegmans, Whole Foods, Kroger, there's always a deli section with hot prepared food. Well, you cannot purchase that hot prepared food with your SNAP benefits. You have to wait until that same food, that same rotisserie chicken, is under the cold storage. Once that same item is now cold, now that it's eligible, you can purchase it with your SNAP benefits. Other items you can purchase with SNAP is fruits, vegetables, meat, such as poultry, fish, dairy products, breads and grains, snacks, beverages, and seeds that grow plants that could potentially produce food that the household can eat. You cannot purchase tobacco or alcohol products. You also cannot purchase vitamins, medicines, live animals. And again, you cannot buy food that is hot at the point of sale. You also cannot purchase pet food, cleaning supplies, paper products, hygiene items, or cosmetics. So remember, with SNAP benefits, you can buy food or seeds that grow plants that could produce food. So let's talk about those SNAP myths and misconceptions. One of the biggest SNAP myths and misconceptions that I hear is this first one. It's always about work. Those who do not work and receive SNAP are able to work, but they are taking advantage of the system.
Well, this is simply not true because in order to receive SNAP, you have to be working. You have to prove that you're working at least 20 hours per week. And if you're not able to prove that, then you can only receive SNAP benefits for 3 months. That's it. And after that third month, if you can't prove that you're working those hours, your benefits will be cut off and you won't be able to receive them for, I think, 36 months or 3 years. Another common misconception is that recipients receive more help than they need with SNAP. Well, we definitely know this is false because we just talked about the federal minimum benefit for seniors, right? That federal minimum benefit, the minimum amount in SNAP benefits that seniors can receive is $23. So, knowing that, do you think recipients receive more help than they need? No, I don't think so. SNAP recipients use benefits on non essential luxury items. Luxury items, the only items you can purchase with your SNAP benefits is food. And so I don't think any food can be considered a luxury item. A big myth is that SNAP is bad for the economy. This is one of the biggest myths. SNAP is actually one of the best things for this economy. If you didn't know, SNAP goes further than a regular dollar, right? SNAP uh, contributes about 80 cents more per dollar than a regular dollar being spent at a grocery store, meaning grocers are getting this money that they can then use to purchase more food and also use to pay their employees. If we took SNAP out of the economy, that would be removing so much income from these huge grocery stores. Another myth, you cannot receive SNAP if you are working. That's not true. It's actually the opposite. You really can only receive SNAP if you're working, if you're not also disabled. You cannot receive SNAP if you are retired. This is definitely false. A lot of SNAP recipients are actually older adults who cannot work due to a disability or due to their age. If you get benefits, you are taking them away from someone else. That is completely false. One fact that has blown my mind ever since I learned it was the amount of SNAP benefits that go unused each year. And when I say unused, I mean unclaimed. Like these benefits are just sitting there waiting for people to apply for them, right? Every year, there are over $13 billion in unused, unclaimed SNAP benefits, right? So keep that in mind. When you think about SNAP and you think if you get them, you're taking them away from somebody else. Well, every year there's billions and billions of SNAP benefits left over. So you're not taking them away from anyone else. You're actually using a benefit that you're entitled to. So let's discuss some SNAP eligibility factors. So to determine your eligibility for SNAP benefits, social services will look at several different factors to determine your income and your expenses. The first thing they will look at is your household composition. Household does not mean everybody that lives in your home or at your address. It's actually the individuals you prepare and cook groceries with the majority of the time, right? So, say you live with your wife, but your child also lives with you, and your child has a child that lives with you as well. Well, if y'all don't all cook together majority of the time or buy your groceries together the majority of the time, maybe you and your wife are on one SNAP case and your daughter and grandchild are on their own SNAP case because y'all keep y'all resources separate. SNAP also looks at your gross income. So this is income before any taxes. They will also look at your citizenship slash legal status. If you are not a United States citizen or a green card holder for at least 5+ years, you will not be eligible for benefits. They will also look at your income after calculating any deductions that you might be eligible for. And then they may also look at certain expenses, such as medical bills, childcare expenses, utility costs, housing costs, and a lot of these incomes or expenses may be required to be verified through some sort of document. Those who cannot receive SNAP benefits, those who are undocumented, individuals who are on strike, and people who have previously violated the program. So, this is the income chart for SNAP. Federally, they used 130% of the federal poverty guideline. So, for an example, across the country, right, no matter what state you are in, if you make less than 130% of the federal poverty level, which is for a household of one person, $1,632, then you may be eligible for SNAP benefits. But like I said, states can opt into certain ways to administer the program. In Virginia, and probably some other states as well, we use the 200% of the federal poverty guideline to determine if individuals may be eligible for benefits. And so for a household of one person, that would be $2,510. So if you're in Virginia and you're a household of one, meaning you only cook and buy groceries for yourself, if you make less than $2,510 a month, that means you could be eligible for SNAP. And the maximum SNAP benefit for a household of one is $292, right? And so again, if you're a household of three, meaning you cook and buy groceries for yourself and two other people, and you make less than $2,798 a month, then that means you could be eligible for benefits. And the largest benefit amount that you could be eligible for would be $768. This income chart changes every October. Okay. So that means 30 days from today, it's going to change again. So last year, before these numbers were updated, they were about maybe $70 to $80 less. So I'm guessing it's going to be bumped up that little bit amount too. So even if maybe you make a little bit over these amounts, maybe in October, when the numbers change, you could potentially be eligible for benefits. So we know that federal minimum benefit for seniors is $23, right? So let's talk about how to best maximize benefits.
And may I just jump in here quickly, Monica, with a question that was asked, and again, you've done a great job talking about the eligibility. Could you jump back to the previous slide? The question that was put forward was in reference to assets, I believe. In
Yes.
terms of, you mentioned the amount that people could earn and how that modifies each year. One of the questions, hey, what about my mother who owns a house, two people living with her, plus she has two separate units. I don't know if that's within the house or two, rental properties with paying tenants. Let's just start with a blanket question, and that is, do assets come into play, or is it purely based upon income?
So the priority is income, but depending on your situation. So for an example, if your assets are over a certain amount, or maybe you receive some sort of income from your assets, if they exceed that maximum, then that person potentially could not be eligible for benefits. But for example, if there is an older individual and they own their own home, they own a car, but they don't have income or regular income, or their regular income is underneath the max, that person could potentially still be eligible for benefits, right? So it all depends on what everything looks like all together. So if that person has a certain amount of assets and they also have a certain amount in income, those two things together could change the scenario.
I really appreciate that answer. It's a very full answer, and that's getting to the heart of the question. Another piece on eligibility. At one point, you said, SNAP benefits are for those who are working, and then
Mhm.
later, a question about those who are retired.
Mhm.
So, is there a certain age limit at which individuals are exempt from the work requirements? That was a good question posted in chat.
Yes, and it actually has changed recently. I believe the work requirement has gone up to 64. So if you are 64 and younger and you have a dependent that's over 13, you have to adhere to that work requirement. But if you're over 65 or you have a dependent that's younger than 14, then you do not have to adhere to that work requirement. There are other exemptions to the work requirement as well. Due to some recent federal changes, veterans are no longer exempt from the work requirement. Children aging out of foster care are no longer exempt from the work requirement. And it's made the age go up, I think, from 55 to 65 due to the
Well,
current.
I really appreciate you mentioning that because there are a few questions in terms of when those new regulations take effect, and one whether sugary beverages and some snacks are
Mm,
maybe no longer allowed. Anyway, I don't want to rush your presentation. You're doing a great job, and I
mhm,
appreciate you being cognizant of that, of the changes that are underway. I also, when you were gone, just want to make sure that I shared with folks that food banks often have outreach coordinators that are, able to pull up the current eligibility amounts, the program requirements and boundaries. And that's why, AARP encourages folks to reach out to actual technical food banks in their area. I have dropped a link to Feeding America's food bank locator website for folks to find food banks in their area. Not everyone lives in the Blue Ridge area
no,
in yours, but I super appreciate what you're sharing with us and continuing to point out that these rules and regulations can change. So we need to make sure that we're working with those who have that most up to date information.
yes, and thank you for sharing that with the group, Brian. Even though I'm located in Virginia, there are food banks all over the country that engage in this work that we're talking about now. I've learned like about all of this from food banks all over the country. So no matter what state you are in, there's probably a food bank near you that's also engaging within SNAP outreach and that are really trying to help people get connected. Regarding like when those changes are going to take into effect, we have not heard official notification from the Virginia Department of Social Services, but we have heard from the Virginia Poverty Law Center that these changes are being in effect immediately. So the changes to the work requirement, the changes to the citizenship status eligibility. So recently, it became true that refugees and asylum seekers are no longer eligible for benefits. All of these things are being implemented currently. So if someone has a SNAP case and because of these new changes, they are no longer eligible, when their recertification period comes around, whatever caseworker reviews their case, they will see that they are no longer eligible and will notify that individual and their benefits will be cut off. So these changes are impacting people's benefits now, right? And it's whenever that recertification period is, and that's different for everybody.
Thank you, Monica.
No problem. Regarding the snacks and sugary drinks, this is a very interesting conversation that is going on all over the country. So there are states that are submitting waivers to try to pilot programs to restrict what items are being purchased with SNAP benefits. Virginia hasn't decided exactly yet, but the governor has been entertaining some ideas of waivers that would restrict purchasing of certain snacks and certain beverages, but we just don't know any specifics yet. But those changes could come in the next couple of years or so. All right. So, and again, once I'm done, I'll be sure to look through the chat to ensure that I've covered all questions. So feel free to throw some more in there. All right, so this income chart, very important. So next we're going to talk about how to maximize benefits. If you have certain expenses, you could potentially be eligible for a deduction, meaning when social services get your SNAP application and they see you have a certain expense, they will deduct a specific amount from your net income, meaning your SNAP benefit amount will substantially increase if your net income is low. So there's a shelter cost deduction. If your shelter costs are more than half of your household's income, you are eligible for shelter deduction. That includes rent, mortgage, HOA fees, real estate taxes, and utilities. If those costs are more than half of the household's income, then you could potentially be eligible for a deduction. And you can also be eligible for a standard utility deduction if you pay to heat or cool your home. If you pay to care for or a dependent, maybe you're supporting someone with um, if you're caring for a dependent and it's necessary for your household to seek employment or comply with employment requirements or attend trainings, you could potentially be eligible for deduction if you're in, what does it say, in good standing with the employment requirements. If you have earned income, meaning you receive income from a job that's not Social Security or it's not a retirement, 20% of your earnings can be deducted, right? But it does not apply to any unearned income such as Social Security and child support. This earned income deduction makes a lot of people eligible if their income is just a little bit over the max. There's also other deductions. There's deductions based on household size, if you pay child support, if you're in a homeless shelter, and you could also utilize Virginia Fresh Match programs to maximize your benefits as well. Because if you go to a farmer's market that utilizes Virginia Fresh Match, you could double your bucks potentially. So let's talk about the medical deduction. This deduction is especially helpful for households who are 60 or over or disabled. This deduction allows 60 or over or disabled individuals to subtract certain out-of-pocket medical costs from their gross income, right? For an example, if you pay for medical or dental care, if you pay for a Medicare premium, if you pay for eyeglasses or you pay for supplemental insurance, if those expenses are greater than $35 a month and they are not reimbursed, you can list those expenses on your SNAP application and they will be deducted from your monthly income, right? Which means it will substantially decrease your net income, which would substantially increase your monthly SNAP benefits. So again, the lower your net income is, the higher amount in SNAP benefits you could be eligible for. So
And
remember,
Monica, can I just
yes,
say there is a question in the chat referencing you mentioning the word doubling, something
oh,
about
yes,
doubling by going somewhere. Can you just, Joy was asking in chat, could you repeat that again for clarity?
yes. So if you go to a farmer's market that participates in Virginia Fresh Match, this may be called something different in your state. But in Virginia, we have a program called Virginia Fresh Match. If you have SNAP benefits, you can take them to the local farmers market that participates in the program. For an example, if you have $23 in SNAP benefits, The farmer's market will take that $23 and give you $46 to spend at the farmer's markets. So that's what I mean by doubling the bucks. I'm not sure what the program is called in any other state. If anybody knows like what the program is called in your state, and if you're not in Virginia, please put the name in the chat. That could probably be helpful for anybody that's looking. But
And
in
I'd like
Virginia,
and I'd like to add that in addition to the food banks promoting this, that oftentimes they work with the area agencies on aging to get the word out and to push that benefit to others. And so in Lynchburg, we've worked with the Central Virginia Alliance for Community Living, as well as in Roanoke, working with the local Office on Aging. So individuals that are participating here today may already be working with or alongside their local Office on Aging, and feel free to ask there if you don't have a relationship yet with the food bank in your area.
oh, great point. Great point, Brian. You also reminded me that the agencies on aging also have a voucher program that they're implementing. I'm not sure if it was just for the summer, but older adults were eligible for a $50 voucher to utilize at the local farmers markets. So if you do contact your local area on aging agency, feel free to ask them about that voucher as well. All right. So for all of my older adults in the room, if you are interested in applying for SNAP, I would highly suggest utilizing the Elderly Simplified Application Project. So this SNAP application is way shorter than the regular application. So whether you're doing the paper application or whether you're going online to apply or whether you're applying over the phone, once you notify that person that you're 60 and over and do not have any earned income, you will be put through the ESAP application process. Meaning, if you're found to be eligible, you will receive benefits for 3 years before you will have to recertify. So that means you will receive continued benefits for 3 years before recertifying. It also excludes some questions, such as those related to pregnancy and education. It waives the recertification interview requirement. It makes use of data matches to reduce the amount of client provided verification. What that means is that social services is not going to be hounding you for all sorts of documentation to verify your information because they can verify it by matching it across different agencies. And that's what they do if you do an ESAP application. Again, there's no 12-month certification. ESAP households will have a 36-month certification, meaning you don't have to verify your information or reapply for 36 months. And you will not be subject to interim reporting.
And so I just want to add again that since there's a lot of individuals requesting information from other states, and so what we're doing is trying to point you to your local food bank and to the Monica that exists in Georgia and Texas and Arizona and Illinois so that
Yes.
they can walk you through the process. And it's very possible now that you've attended this webinar, you say, hey, I've been told that there's a simplified application because I'm over 60, would that apply to me? And most likely they'll say, oh, that's great. That totally makes sense. We would like to walk you through that and can answer those state specific
Yes.
pieces of information. I'm not going to ask every one of the state specific questions because Monica, I know you're an expert in Virginia, and I don't want you to, feel like you need to research on the fly here or overstate what we know about Virginia and think it's
Thank you,
applicable to
Brian.
those other states. Thanks.
I wish I was an expert on the national laws, but unfortunately, y'all, I am not. But bear with me. So if you're in Virginia, these are some ways you can apply for SNAP benefits. If you're in Virginia, you can text the food bank. And if you're not in my service area, I will direct you to the Virginia call center. Okay. Anybody in Virginia, no matter what county or city, call that phone number to apply for SNAP over the phone. You can also apply online or download a paper application. For anybody that is not in Virginia, please utilize the Feeding America link that Brian put in the chat, because that is how you're going to find your nearest food bank and get access to this information that is state specific. All right. So before I go through questions, I want to share some information here. If you scan this QR code, you'll get access to our SNAP screening form. Again, this is very specific to Virginia, right? If you go through this form and answer the questions and you live in Virginia, it will tell you if you're potentially eligible for SNAP. And if you are, it will give you instructions at the end on how to apply, right? So if you're not interested in applying, you know you're not eligible, please share this information with people who could potentially be eligible, right? That could be anybody in your community, older adults, younger adults, young families, people who are just working, trying to make ends meet, and also advocate, right? When you hear people talking about SNAP, especially spreading myths or misconceptions, make sure you speak up and combat those myths and misconceptions with facts, okay? That is the best way we're going to be able to ensure the people who need this benefit can get access. All right. So I know I have some questions. So let me look through this chat to see if there's any questions that I weren't able to get to. Can my mom still receive? Oh, we did that one.
Yeah, and let me, if you'd like, I've kind of curated these questions in a way to make you not have to read everything. Um, I'm not trying to pretend like I know it all by any means, but I've tried to use the time wisely while you were doing a great job presenting. Thank you for everything that you've shared. One of them is in reference again to households and individuals and different ages, but if someone is unemployed, this person saying my sister's unemployed, looking for work. I'm not going to mention which state. We're just going to pretend it's Virginia. She lives with her adult son, who is
Mhm.
working, so in the same household. Um, they don't share food expenses, but could she get SNAP on her own as she searches for food, or will their eligibility be based on the income in the house of her son? You know, how does a person work that's in a a family situation of that variety?
Yes. So remember, household is defined as the people that you cook and buy groceries with the majority of the time. So this mom and her adult son, meaning he's over 21, if they do not pool their resources together, everything is separate, they apply for SNAP separately. So if the son were to apply for SNAP benefits, he would not include her information, her employer information, or her income information, only his.
Great. Thank you. A question in reference to Meals on Wheels. There are some certain eligibility requirements in different organizations that provide Meals on Wheels. Obviously, SNAP eligibility requirements are very different. Do either of them interact, compete with one another? Is it possible that because one is receiving Meals on Wheels, that they would less likely be eligible for SNAP benefits? I don't think so, but just want to get your input on that.
Oh, that's a good question. I haven't gotten that one before, but no, they do not talk, they do not interact. SNAP is a federal program, right? Meals and Wheels, more community based, nonprofit based, right? So just remember that. SNAP does not interfere, just to provide more information, SNAP doesn't interfere with any public benefit program, right? So if you know someone who's getting WIC, they should also get SNAP. If someone is on Medicaid, they should also get SNAP. These programs should be paired up together and combined so that people can get everything they need.
Excellent. Thank you for pointing that out. Again, you mentioned that different states have different levels of benefits, or that somehow the state can interact with the federal program. So I think that answers one of our top questions, saying, are SNAP benefits for each benefits the same for each state and by county in each state? So there is
Mm,
some modification there because of how the state interacts with the federal program, correct?
yes. But if you have SNAP benefits in Virginia, you can take your SNAP card to another state and use them there.
Great point. That's good clarification. I'm not familiar with the term over the counter slash food benefit card that maybe
Mm,
some insurance companies, maybe again, I hesitate to even say Medicare Advantage, but I think
I've
Medicare
seen
Advantage.
it.
All
I,
right.
I I worked at Food Line for a couple of weeks, like a year or so ago, and a
Yes.
lot of older adults would come through the line with some sort of health insurance card that actually paid for certain foods that they had. I don't know any information about it, and I haven't
Okay.
been able to get any information about it, but I've seen it. I know it's there.
And so I'm guessing that with what you do know and what you know of the application process, that that's not a question that is being put forward in the application process. So almost for sure, there's not a, compete or,
Mm-mm,
challenge in,
no.
hey, I'm receiving so many benefits through my insurance, therefore I
Mm-mm,
don't no longer am eligible for the SNAP benefits.
no. And I think the only situation would be if you're in a facility getting your meals provided to you,
Yes.
that would be the situation in which you wouldn't be eligible for SNAP benefits.
That makes sense.
Mhm.
For somebody on Medicaid, for instance, and in a full-time nursing home or
Yeah.
long-term facility where their meals are being provided and paid for. All right. This is a great question by Joy just in. Before I even read it, I'll say if you have a question that you feel like you've submitted and that we've somehow overlooked or haven't been able to hit yet, please just type that again into the chat box. I really am enjoying seeing everyone say, thank you, Monica, for this great information. And you've done a great job presenting. So we're getting good feedback already. But I just want to make sure we haven't missed anyone's question. Um, Joy asks, did Monica just say that you could use your card in another state? We do live on a state line and shop across in the other state because it's less expensive.
Yes. You can
That's what
use
I
it in
heard.
another state.
Great. That those SNAP benefits, anything that you receive on in terms of your card could be swiped at the grocery store wherever you are.
Mhm.
Great. Another big thank you from Carl. I want to say that Carl submitted a recipe book online that the U.S. Department of Agriculture has put forward utilizing SNAP ingredients. And I thought that was a very helpful thing. So thank you for being with us today, Carl, and for sharing your insight into the conversation.
Mhm.
I believe that that finishes up the questions that were asked by attendees. Thanks for being our key
I got
presenter and speaker.
one.
Yes, Monica, maybe I missed one that you saw.
There was a follow-up on the son and the mom. They share rent and utilities, but not food expenses. So you said it there. They do not share food. So if they aren't purchasing groceries or sharing meals the majority of the time, then no. If they're sharing rent and utilities, they are roommates, right? They are roommates. They do not share meals. I've heard people say they are reluctant. Yes. So that is people are very reluctant to apply for benefits because of the negative experience they can have within the government agencies that they have to navigate in order to verify benefits or keep getting benefits. And so that's why social services has asked food banks to engage in this work, right? They know that we're constantly in their community. They know that we're the main ones talking with people who need food on the regular. We have that trust and that rapport built. People do not want to go to social services because social services is under resourced, overworked, and their workers are struggling sometimes. And so the food bank is here to help people apply for SNAP so that we can provide a more trauma informed experience. a more client-centered experience. And so if you are an individual that could utilize that, please go to that Feeding America link and locate your nearest food bank. And thank you all for showing up. This was great.
Wonderful. Well, we're at the end of the hour, and I want to say a big thank you to anyone who's in the social services field. I know that Anna Joe, the university student who has joined us today and is part of the activity, and again is trying to make a difference in the community, is entering the field, recognizing that, as you said, oftentimes those in that social work field are over
Yes.
a tremendous amount of burden on them, are trying to make a difference in people's lives. And so we're all trying to work together. And that's why I'm glad that AARP uses volunteers in an intergenerational way to help inform and meet the needs that are out there. Monica, thanks for all that you're doing day in and day out at the food bank here in Central Virginia. And I want to thank everyone who tuned in from here in Virginia, as well as the other states, knowing that AARP is attempting to make a difference. We care about hunger and how it impacts individuals of all ages, and are advocating for seniors on a day in and day out basis. So thanks for being with us. And with that, we will conclude the program. You'll be sent a recording by email within the next 2 weeks. Take care.